Hi everyone, thank you for making the time to listen to our problem today. Most of you have probably been to hospital at some time in your life, whether you've had your tonsils taken out or you've had anxiety or you've had a baby. But what you probably don't know when you go to hospital is that although your treatment may be undertaken all at the one place of care, there are typically multiple disparate and unlinked systems capturing every part of your journey. Metro North have approximately 50 of these systems, recording such patient events, incorporating interventions, treatments, scheduling, wait lists, administration, dosing, medications, therapy, and patient flow movements. Example slide. So here you can see a very simplified version of someone coming to hospital. You come in an ambulance and you're recorded into EDIS, the emergency department system. Then you may be admitted into an inpatient bed, so you go into hibiscus, which is our patient admission system. You may also go on the elective surgery waiting list, so let's say this is an orthopaedic patient. There'll be some pathology potentially, and then you'll also have some x-rays on whichever part of your bones you've broken. And you're all bundled up and sent off home after you're treated, and then finally you may be scheduled into our outpatient appointment system to come up 6 weeks after your discharge to make sure everything's healing okay. Each system records patients' episodes using a medical record number, which is a unique identifier, and it's unique to the facility in which that patient is treated. Now, despite the rich and detailed data collected, most systems are not linked, and they do not link patients on a historical basis in any sort of chronological order. So Metro North are able to generate CSV files from most of these systems, but require heavy manual deterministic matching to link usually in Excel. Because of the size of the data sets, this becomes virtually impossible and time consuming just due to the size. Slide. So as you can see, I've just blanked out the other stuff that's not relevant here, but essentially what we want to do is we're seeking a solution to link multiple large individual patient level data sets together to create a longitudinal time series and shift from analysing data at a single discipline episodic level into a linked, reaggregated and system-wide data set. Slide. So initially, the data sets that would be linked are the emergency department presentations, inpatient admissions, and outpatient attendances. And what we're calling this is the foundation set. So in our vision, we've got a much larger program that we consider this would fit into. But essentially, if we can do this component first, it sets the scene for us going into the future. There is currently no opportunity to integrate systems together. Rather, this would be integrating extracts. Extracts are obtained through scheduled intervals using crystal reports direct from the source systems. Metro North currently doesn't have a data warehouse. The solution would need to offer some access to a small number of users, currently 4, to the output solution. The solution would need to be easily replicable to apply to other systems. And as you can see in that circle around the lighter blue, you can see they're just a representation of some of the intervention and treatment systems that feed into an inpatient admission, as well as outpatient and ED, but just mostly inpatient. Metro North are also looking for a solution about how to visualise the linked data. So you can see down the bottom we've got kind of a rip-off of a DNA profile sort of thing, but each one of those colours would represent a different type of intervention, whether it be, and obviously it's colour-coded here to show you how they link together, and the grey bit's obviously a time outside hospital. So overall, what's the application of this? Well, it's big. At a statewide level, there's huge opportunity, and the benefit to everyone, including the hospital and the patients, is it's safer in hospital avoidance. If we can use this data to help people stay out of hospital, that would be fantastic. It would also allow us to have predictive management of hospital systems rather than siloed treatment interventions. It would be a patient-focused, centred approach of providing a timeline of their care continuum. And finally, provide reliable historical insights into future discrete event simulation modelling for proposed health services. Thank you.
Again, questions from the audience? Who wants to get started? Must be some questions. This seems to be a huge information management challenge. So we'll get started and ask... oh, we've got one here.
I'll just be the devil. I think you put forward an awful lot of information. So really, how much of that can be achieved in the 12 weeks and what are you really looking for?
It can be achieved because I've done it in terms of in Excel, but what took me, I linked 3 years of data together, inpatient and ED data together in Excel through multiple files because the sizes were just too big. But it is definitely doable. But I guess we're looking for a solution that is going to be able to collect and integrate these extracts together very quickly and with a level of automation that we don't have available to us. Whether that's in Excel or something else, we've explored things like Power Pivot and those sort of things, and we do have another platform called Click, but each of these don't seem to really deliver what we're looking for, which is we need to get this stuff out and consolidate it together so that we can do the analysis, and at this point in time we can't do that. So it's really about speed and efficiency and a consolidation solution for us.
Hi. What kind of analysis is that? Is that searching up individual patients or it's completely anonymised?
For the purposes of this exercise, it will be anonymised. And we have spoken with certain areas of the business about what data we'd be able to release as part of the program. We're currently, we believe that there are some dummy data sets which represent what we want to do, but alternatively, if we can't do that, we will create a dummy data set that will be anonymised.
Any further questions? Any tweeted questions? No? Thanks, Linton.
Thank you
very much.
Ta.